Today we are going to talk about the ideal density of plantation. The density which is planted per square centimeter in the recipient area. That is how many follicular units are transplanted in a given square centimeter along the hairline, along the mid-scalp, along the vertex and the crown. This is a very controversial issue in the field of hair restoration surgery. Marketing promises the patient the moon, and many patients who have not done the research properly fall for such marketing and then complain about the results. Now, there is an ideal density. So the human body is not a piece of cement or a piece of wood that it can take any amount of load. The human skin is a living tissue, and living tissue survives on blood supply. It has a particular load for which that particular blood supply is ideal. If you increase this load, the equilibrium is going to go out of control and it could lead to bad results. More and more clinics say that they can plant up to 65 to 100 follicular units, that is grafts per centimeter square. However, these are tall claims, and why they are tall claims we are going to discuss in this topic. In a study which was carried out in the United States, it was seen that in a percentage of 18% of people who were seemingly having a head full of hair had densities as low as 38 to 78 follicular units per centimeter square along the hairline, a little less in the mid-scalp, a little lesser than that in the vertex area, and even less in the crown area. However, you could not tell that this patient was any different from a person who had a per square centimeter follicular unit density of up to 100 or 110 follicular units per centimeter square. So what is the secret behind the visual appeal or the visual look, or how does the eye get deceived into believing that with less follicular units you get a full looking appearance? Now, this has wholly got to do with the distribution of singles, doubles, triples and even 4 follicular units, and the way they are arranged. Not very geometric, not in a straight line, but in a staggered manner, following the natural triangles in which they naturally occur. And this is a skill and the art which a hair transplant surgeon, if he masters, he can cover the whole head with lesser number of grafts, strategically placed to give a full appearance, a head full of hair appearance. It is counterintuitive to not believe the fact that the more follicular units you have in a given centimeter square area, you will not have a better result than the other person who gives lesser number of grafts per centimeter square. However, this has its limitations. The amount of grafts that we can put per centimeter square or in a given area depends upon your level of baldness. You cannot compare the density given for a person who has a mere grade 2 pattern baldness to that of a person who is suffering from grade 5, 6 or 7 pattern baldness. In a grade 5, 6, 7 pattern baldness, if you give high density in the front, somewhere or the other you'll fall short. And that is not meeting the objective of the patient. The objective of the patient in most cases is a head full of hair. May not be very dense, but it should be giving an appearance of hair all over. So if you waste your grafts in a patient with extensive baldness in a limited area along the hairline or mid-scalp, by increasing the density to as high as even 50 per centimeter square, it is not going to serve the purpose. You are not going to have, at the end of the day, a happy patient who will speak high about your practice. What is the normal follicular unit density per centimeter square? The normal follicular unit density can vary between 75 to 110 follicular units per centimeter square. So that means that if a person with 75 or 80 follicular units per centimeter square is given up to 40-45 follicular units per centimeter square, he should have a decent enough result. Why? Because to other people, you start to be seen as balding only when your overall density dips down below 50%. So if for you 90 follicular units gives a very normal full look and such a normal density in your scalp, even if we put 45 follicular units in a given area per centimeter square, it should give you a full look, because we are just reducing the density to 50%, below which balding starts. So there is a very fine equilibrium between the number of grafts available and how much density a surgeon is prepared to give you to meet your future goals. In hair transplant, in my practice, if a person has grade 2, grade 3 baldness, 45 to 55 follicular units per centimeter square is a reasonable density to give to expect a reasonably good result to give a patient a head full of hair appearance and at the same time meet his future goals to treat him as his balding or as his balding pattern unfolds over the years to come. So it is to be noted that in case of FUE, the grafts are machine cut. They are trimmed by the punch. All the grafts are of similar diameter. This is different from the grafts of follicular unit transfer, that is FUT, where the grafts are hand cut, hand trimmed by different technicians. Not one technician does it. There are 3 or 4 technicians which cut, which sliver, and which dissect the grafts. So the grafts in FUT are variable. So when you have variable thickness grafts and when you have bulky grafts, it is very difficult to give a higher density per square centimeter. In FUE, since the grafts are closely trimmed, FUE is ideal for giving higher densities in patients who have lesser degrees of male pattern baldness, grade 2, 3 and 4. So this is the advantage of FUE as far as the density per square centimeter is concerned. Another point to be noted is that if we give a density between 45 to 55 follicular units per centimeter square, in my practice and in my experience, I have found that most of the grafts, 97% above, will survive. So the equilibrium between the available blood supply and the density that is achievable is about 45 to 55 per centimeter square. Case after case, year after year, we have become convinced if we exceed more than 55 follicular units per centimeter square, the result is variable. For grafts, if planted in high density, compete with one another for the available limited vascular supply. And when vascular supply is limited, and when the graft load for the blood supply, for the nutrition is more, the all or none phenomenon can occur. Either all grafts will survive, which is in a very small minority, usually in very young patients, or all of them will fail to grow. Now this is a disaster. This is a disaster. The same patient who wanted very high density per centimeter square will repent having got the procedure done from you. Is beyond your control, beyond a scientific rationale. Also in certain skin conditions, like when a patient is a diabetic, though his diabetes has been controlled, but he has microangiopathy. And if you give higher incisions per centimeter square, this can lead to infection. Infection can lead to ischemia, that is dead skin. And dead skin can lead to a patch of scar where hair can never grow, where you can never plant hair, and which will look so bad. And since hair transplant is a cosmetic procedure is a zero error specialty, it is not advisable to venture above 55 follicular units per centimeter square. Definitely above 60, this is a realm where angels fear to tread. If you want densities higher than 60, you are responsible for it. But at my center, we do not anymore give densities more than 55 follicular units per centimeter square. Patients who have even greater baldness pattern, that is grade 5, grade 7, a little lesser may be ideal for them to give them a fuller head look. Because in extensive baldness, if a patient has been counseled properly, if his expectations are realistic, he only wants full coverage with a decent amount of density along the hairline and along the mid-scalp. People do compromise with lower densities along the crown area. But what is the ideal density below which, if you dip, the hair transplant result will look very sparse? And that is 40 follicular units per centimeter square. And this 40 follicular units per centimeter square does not mean that all of them will be singles and doubles.
Make sure to subscribe, tell your friends, spread the good red word, and hit the little bell below so you get notifications every time we come out with a new show.
Because even if you plant more than 55 follicular units per centimeter square, and most of them are singles and doubles, the result is not going to come, because an adequate distribution or an adequate ratio between singles, doubles, triples and fours as it occurs in nature is required for a reasonable optimal result. So to summarize, a person is given with only fixed amount of donor area grafts that are available to him in a lifetime. A person can have baldness varying from grade 3 to grade 7. The amount of grafts that you can put in a given centimeter square depends upon achieving a fine equilibrium between graft availability and the area to be covered to meet the stated goals and objectives of the patient in consultation with the doctor who is the final arbiter of what density should suit him, meet his future goals and objectives as his baldness pattern unfolds over the years. So if you have any further questions about density, about plantation, about my technique, or any other question about hair transplant, please do not hesitate and do drop me a comment below, and I'll be very happy to reply back. Take care till the next video. Thank you for watching.